COVID has affected us all, and with all the negativity surrounding it, it's often hard to find the positive. One of the blessings it has given us is the opportunity to build an avenue for creating change, starting right here in our community. Discussing topics that affect us most, such as racism in healthcare, maintaining a positive mindset, creating change, the importance of advocacy, and the many lessons we have all learned from COVID. If you or your organization are interested in speaking engagements, send a message to quadcast99@gmail.com, reach out on Facebook at Quadcast, or online at drkwadwo.ca.
Welcome to Solving Healthcare. I'm Kwadwo Kyeremanteng. I'm an ICU and palliative care physician here in Ottawa and the founder of Resource Optimization Network. We are on a mission to transform healthcare in Canada. I'm going to talk with physicians, nurses, administrators, patients and their families because inefficiencies, overwork, and overcrowding affects us all. I believe it's time for a better healthcare system that's more cost-effective, dignified, and just for everyone involved. Ladies and gentlemen, one of our Solving Wellness initiatives is we're talking about sleep. And we're talking about sleep for healthcare professionals because we know how challenging it can be from all levels, whether you're doing shift work or whether you are doing that, 7 to 3 shift, but you have your kids at home. This could be quite challenging. So I brought my boy, Dr. Ruwan Amaratunga, sleep specialist, respirologist. We go back, my friend. I think we go back.
We do. I was actually thinking about that the other day. I was remembering a shift in the ICU a long time ago. It was an R2, you were an R3 or R4, one or the other. I can't remember.
Yeah.
It's been a while.
No, we go back. And so for those that are following now, I should mention, if you put SW in the chat box, you'll get a link on how to sign up for Solving Wellness. We're almost up to 100 members, guys. This has really been blowing up. It's really exciting. So thank you, those that have signed up already, and those that haven't, get on the train, yo. Changing that boogie for real. Anyway, Ruwan. So we're talking about sleep. Actually, I want to take a step back. What got you interested in sleep, actually? Like, it's not the most common, lens for clinicians. So what got you into that?
It's actually, that's a nice question. It's funny, so sleep was just one of those elective rotations you can do in respirology. I did it the first time and I actually thought, I don't know. It's not as exciting as, fancy lung disease and ILD and all that kind of stuff. But I actually did it a second time. What I realized is that I actually could make a big difference in people's lives. Not that I don't do that in respirology. I think I do. I hope I do. But the evidence is quite clear in sleep medicine. When we could be in person with people, it wouldn't be irregular for people to hug me, because I made such a big difference in their life. And also, it's not just that. I realize when you take a step back and you look at determinants of health and big problems in our society, sleep restriction and the consequences of that are huge, right? They have so many costly downstream effects that I actually do believe, humbly, that if I can help more people sleep better, I could improve the general health of population, decrease healthcare expenditure. I really think that that's the case. And, we all know that prevention, right? That's where you got to spend, I think, your money, right? I mean, that's what you talk about all the time, right? And
100%.
So those are the main reasons, right? That I could actually make a big difference, but for people individually, but I think also systemically. I'm not saving people in the ICU like you are from COVID. I'm getting further away from that as my career goes on. But I think this is, also valuable from a larger kind of perspective.
Oh my God. If you think of the scale, man, as you mentioned, if you could intervene early, think about the downstream effects. Cause I got to tell you, when it comes to 80-20 of health, nutrition's up there, but also sleep. It's huge. So maybe Ruwan, even jump into what medical issues you could see for when people are sleep or are sleep deprived or having issues with sleep.
Yeah, I mean, obviously it's a huge question. I always like to explain, I mean, we're talking to healthcare workers, so I can talk a little bit about the biology here and the physiology, but, all of our individual bodily systems, our different organs, even our cells, have a chronobiology to them, right? They have their own intrinsic circadian rhythm. And so it basically guides what they're doing at what time of the day, right? Every cell isn't constantly on 100% producing every gene it has all the time. That's not how it works. And, if you look at each of these, millions and billions of processes, maybe millions, I don't know what the exact number is, they actually have to be coordinated, right? Mm-hmm. And so that's what really the function, I think, of sleep is primarily, right, is to ensure good functioning and performance of the organism by ensuring that there's good coordination of all the different systems. And so when you don't sleep properly, you have less coordination of these systems and it leads to all sorts of problems, right? So, one example would be when we sleep, we're supposed to have a dipping of our blood pressure and our heart rate such that when we're awake and in the day doing things, that when the blood pressure naturally goes up, it goes to a normal level, right? Mm-hmm. And so if you don't sleep properly, you don't dip as much, and therefore your daytime blood pressure and heart rate will go higher, right? Mm-hmm. So that's one simple consequence. When you don't sleep properly, the exocrine function of the pancreas, for example, diminishes. You produce less insulin, but then also peripherally, because of an issue of this malcoordination, you have less insulin sensitivity mm-hmm. in your cells, right? So that raises blood sugar, which leads to diabetes and systemic inflammation, right? Mm-hmm. We know that lipid handling is affected negatively when you don't sleep properly. The balance between ghrelin and leptin is thrown right out the window. And so people, in fact, who are sleep deprived tend to want to not only eat more, but they tend to eat later at night. They tend to eat higher calorie or more calorie dense foods late at night. And on average, they consume 200 to 300 calories extra per day as a result of being sleep deprived, which then leads to weight gain, right? Mm-hmm. So you can see there's so many circular issues. Inflammation is higher. People who do shift work have higher rates of cancer, unfortunately. People who get less than 6.5 hours of time in bed consistently have less longevity. They die younger. Wow. So hopefully I'm answering your question as you'd like. But
absolutely, that was perfect, because it get down into the basic, the physiology on why there's that discordance in within the body and the ultimate results, like as you mentioned, increased cancer, increased obesity, diabetes, all these things that we're trying to avoid. Yeah. And it comes down to, once again, that prevention piece. If we could do a better address our sleep, a lot of our risk will be decreased. And so I think one of the common questions when you think about this is, how much sleep do you need? Like I just heard you say time in bed, which is interesting because, there's a lot of thought in terms of, if you're in bed and you're not sleeping, what to do and what have you. But just at a basic level, like in your mind or based on what you've read, how much sleep do we all need?
Yeah, right. So challenging question if you want to think about it in a lot of depth. There's been lots of work done on this, and there's some, national level guidelines in the States. Generally speaking, it's based off of studies for many years now. And the number they use is time in bed, because it's a lot easier to do studies that way than actually putting an EEG on everybody and calculating how much they're asleep, right? So the number really is about 7 to 9 hours of time in bed, good time in bed, right? So not lying in there reading for 3 hours, that doesn't count. You go to sleep at 10, and you wake up, you get out of bed at 6. And for most people who have normally functioning sleep, you subtract about 45 to 60 minutes in there. So if they're getting 7 to 9 hours in bed, they're kind of looking at getting 6 to 8 hours of sleep. And so that is the normal amount. Now, these days, everyone's got, trackers and stuff. And so they get this kind of approximation of sleep cycles. If you look at it from that perspective, right, the average sleep cycle is about 90 minutes. If you have 5 of them, that's about 8 hours. right? And so that's basically the recommendation for most of us, right? I mean, there's a huge heterogeneity in the population of what is normal, but within that normal distribution curve, it's that would be the answer.
Right. And, you'll see different, like you'll read about different durations. Even you'll hear about some people just have different chronotypes where they don't need as much sleep.
Yeah.
Do you have an opinion on that? Like when some people they'll say, "Oh, I only need 6 hours. I only need 5 hours." Is that? What do you think when people say that?
Yeah, I mean, I think there could be some truth to it, right? I mean, like any normal distribution, there are always people who exist normally at either end of the spectrum. So there are people who can get away with less sleep. But there are also, I think, of the proportion of people who say that, I think most of them are incorrect. There's a lot of data, right? Most people still fall within the normal distribution. That's why it's a normal distribution, right? And the reason I say this again is that most people, it's pretty clearly shown that feeling well rested often doesn't correlate with being physiologically well rested, right? So in other words, when people are sleep deprived, they've done the studies, they often subjectively feel back to normal a day or two, significantly faster than it takes to physiologically recover by objective measurement, right? So I think that's probably something really important to hone in on there. So when you say, yeah, I'm fine with 6 hours of sleep, there might be a small subset in whom that is actually true, but I think the large proportion is people who just have adapted, and they think that they're doing okay, and there's some value to that, but physiologically, the consequences long term can be significantly negative.
Absolutely. And you actually really bring up a real question that I'm not sure what the answer is. Like, how do you know you are getting enough sleep? Do you know what I mean? I'll just give a personal example. Like, I'm one of those guys that I feel like probably I could get away with the 6-ish hours of sleep on a fairly regular basis. Maybe it catches up. I'm not sure anymore, just being with everything that's going on. Aside from using some of the, like I use the trackers. I try and, do the HRV, which we'll talk about in a second. But what in your, like, for the basic person, what are signs that you are or not getting enough sleep?
Yeah, it is a challenging question based on what I just said. Yeah. But it is a lot of basically performance, right? It's how you feel, right? Are you cognitively where you think you should be? Mm-hmm. Are you emotionally where you think you should be? Do you make healthy eating choices? Again, there's lots of factors that can hone in and affect each of those things, but if you're well rested, and from just a subjective sense, these are the things, right? Do I feel well rested in the morning? Am I functioning well? Am I more irritable or normally irritable? And also, do I think the sleep that I got was good, right? Was I up every hour? Was I getting up to pee a lot, right? Yeah. But we can't answer this question in the isolation of our reality, and that is that most people do have some measurement, right?
Yeah.
And I'm not sure, maybe that's, you hinted we might be going there, so maybe
we can jump in.
Yeah.
No, for sure.
But there are trackers that can help, and so it can help you see if you are getting kind of that 6 to 8 hours of sleep that you think you're supposed to get. Are you getting at least 4 full cycles of sleep, ideally 5? But more specifically, I think the better data that unfortunately a lot of people don't have is HRV. It is becoming, there's increasing evidence.
Heart rate variability, for those that don't know.
Heart rate variability, yes. That is one of the better markers. It's a summative marker, right? It looks at the end. It's an end result of a lot of the different aspects of your physiology. And in short, for again, most people, it's kind of a balance between your sympathetic and parasympathetic systems. Mm-hmm. And so, if you have a higher heart rate variability and you have a lower resting heart rate, at least for you in your range, those are really powerful signs that you're well rested in conjunction with feeling good, right? So you feel good, your HRV is as high as it can be for you, and it's your resting heart rate is in the lower range of normal for you. Those are powerful signs that you're well rested.
Yeah, that's very helpful, actually, Ruwan. So like knowing, because I think a lot of people, if you listen to yourself, listen to your body, listen how you're reacting to normal circumstances, are you getting more irritable? Are you taking off your shirt in public because you're so furious at traffic? Like those are the kind of things to think about. And HRV, I got to say, I love it. We're even using the HRV principles with critically ill patients. If you are having less variability in your heart rate, it's a sign, if even in ICU, that you're likely to be more sick. Like you don't have as much reserve. And same thing in real life. You know, if you're having less variability, telling yourself that you're more tired. Maybe it's a day that you're not going to be training as hard if you're somebody that's quite active and doing that kind of thing. You know, because obviously as we age, we're trying to avoid being injured. Like a lot of us aren't professionals, you know.
Yeah.
You know, so it's I actually love it, and I've the tools that I've used have actually correlated well with, you know, how I feel, and so I think it's a really important concept.
I was going to say something too. Also, you just brought up an important point, because you asked me before about, you know, how much sleep does someone need, right? There is, you know, in the literature, right, the number can also depend on really what metric you care about the most, right? So if your primary outcome is cognitive performance, the amount of sleep that you might need would be different likely than someone whose primary metric is physical performance, right? So, you know, if you're someone who's fairly sedentary and does a lot of thinking work, which is totally, you know, it's tiring.
Yeah.
You don't need as much sleep as someone who is, you know, training heavily and applying a significant amount of cellular and metabolic stress, right? Mm-hmm. They might need, a person like that might need 9 hours regularly. After a hard training day, they might need 10 hours of sleep, right? And that's outside that window, and that's perfectly normal. So I just wanted to put that in there.
No, that's a great point. It's like, what are your demands? You know what I mean?
Yeah.
And it's true, because you hear a lot of these like pro athletes. If you hear what's his name, LeBron, talk about sleep, he's pretty religious about it. And I mean, was it 1984? He's 36 years old, and obviously still playing at an amazing level. And you know, it's exactly what you think. Like, you need that time to recuperate, and and it's different if you're doing mental gymnastics, which, as you mentioned, is exhausting still.
There's also one interesting facet in the literature that has borne out repeatedly, and it's that although sleep deprivation cognitively impacts, you know, memory, learning, you know, creativity, all sorts of stuff like that, for some reason, like true reasoning and very, very complex cognitive tasks aren't actually impacted by even total sleep deprivation. It's really weird. And
really,
if you think about it, it is, and it kind of fits, right? Because you hear about, you know, people anecdotally, of course, like Einstein or, you know, Tesla, or, you know, these people who slept like, or Edison, they slept like 2 or 3 hours a night or something, yet they clearly, you know, created some important things, right? It's kind of interesting because there is evidence for that. Similarly, I would be hard pressed. I would probably pay some money. I don't know how much in a bet, but to find a high performing athlete who doesn't get a lot of sleep and take that stuff seriously. It's just physiologically incongruent. Like, it's incompatible. You can't be a high level athlete and not get enough sleep. There are plenty of non-professional athletes who think that way. Oh yeah, I'll, you know, work out, I'll do anything, I'll get 4 hours of sleep and I'm going to kid it the next day. No, it's not going to work. Sorry.
Yeah.
It's not going to work.
You know what you're making me think though too, Ruwan, is about all of us at work at 3 a.m. or whatever. Like when there's a really, like, I'll speak out of experience. Like, yes, in the, you know, when to me the witching hour was like kind of like the 5:30 between 4 and 6, somewhere around there. Where it's just like you're cold and somebody sick comes and you're just like, oh yeah, like it is just so difficult.
So hard, yeah.
But when there's something that is, you feel there's an important decision to be made about somebody's care, like as much as I mean, this is a subjective opinion. Like you're making the right call. Like you're doing the right thing for the patient, which is reassuring. And it's kind of nice to hear that there's some data to back that up. Because I know I don't like making decisions on my 27th hour. You know what I mean? But if it's important enough, it sounds like we're hopefully.
Yeah, you can do it. Yeah, for sure. Yeah. It's funny. That circadian dip, the lowest point of our circadian rhythm is between 4 and 7 a.m. Mm-hmm. And it's been a while since I've done what you've done, but I remember my training very well. And 5 a.m. Oh my God, it was just the worst time. Your body temperature is also reaching its nadir about that time. So it's the fact that you said that you're cold is very biologically accurate and apt. But you can make complex choices if you can. The problem, again, is that then you get in your car, and you drive home. And we're 50% more likely to get into a car accident. Yeah. Right? So again, this is another issue. But
it's crazy. It's crazy. What about? I mean, we touched on it a bit, but what do you think about like sleep quality? So we talked about duration in bed. We talked about there's sleep cycles, but there's I mean, we did some shows on sleep cycles and with Dr. Kirk Parsley and like different stages. But, do you have do you have an opinion on whether your sleep quality affects your overall feeling of restoration? Like if you spend more time in deep sleep, is that going to be more productive than light sleep? I'm kind of leading you there, but.
No, I mean, it's a good question. It's a complex question. When you look at the kind of internal structure of your sleep, which is, how much deep sleep do you get? How much REM do you get? A lot of that is kind of preset. You have a kind of a potential for what you should do normally as an individual. And the amounts that you get of REM sleep and deep sleep, if they're going to increase or decrease, it's really just based on homeostasis, right? So basically kind of have a normal amount that's your fingerprint. And if you lose deep sleep because you went to bed late one day, then the next day you will get more deep sleep. If you lose REM because you got up early, well, then you're going to get more REM the next night. So that in of itself, like the amount of REM and deep doesn't really per se impact how you feel unless you are deficient in it and you're not catching up on it. Okay, so hopefully that makes sense. Yeah. But sleep fragmentation is a separate issue, right? So how much is the natural pattern that your body wants to have, how much is that interrupted, right? That has huge, God, well, I'm saying huge. It sounds like I'm saying huge. Like, huge, yeah. Huge. I just got to say like a normal person. Huge impacts on how you feel, right? On the restorative power of that sleep. And so a lot of that, so first of all, right, you could have an organic sleep disorder, right? And so when you look at the prevalence of sleep apnea, for example, it's huge, right? It's a significant, right? It's somewhere between 15 and 30% of the population that has
it's crazy actually.
It's huge. I got to find another word. It's massive.
Massive.
I like that.
Yeah. Okay.
So I think that has to be said, right? I mean, that's something we all need to think about. And it can happen independent of your BMI too, right? So just another thing to keep in mind. But then there are many other factors, right? So sleep hygiene, basically, right? Are you using, electronics before bed? How much caffeine are you consuming? Are you exercising before you go to bed? So if you do things that are not conducive to good sleep, and you have a lot of fragmentation, then yes, you are more than likely, even if you had the right amount of time in bed, you will feel worse. And that was the caveat I said at the beginning, right? It's 10 to 6, 8 hours, assuming that that's, good sleep.
No, this is awesome. Yeah, because it kind of ties into that question about catching up. Like I love the way you put it, that homeostasis. The night before, did you get enough deep sleep or REM sleep? Like last, I just got off call And, I went to bed at a normal time last night. I probably went to bed at 11. I don't even remember my head hitting the bed. Like this was like I felt like it was deep. You know what I'm saying? Like that was some deep.
Probably was.
Ass sleep, right? And it's once again, in some ways, I'll give you a chance to answer though, but like it feels like you're catching up. And I know you see different things about can you catch up on sleep? I mean, maybe you could formally comment on whether you can or not, in your opinion.
Yeah, I mean, like most things in life, it can be an issue of semantics and what we think or what we believe or what we want to get out of that answer. So it is complex. But I think if I had to give a succinct answer, I think to the question, can you catch up on sleep? The answer is yes. So, there have been many studies, which I kind of alluded to at the beginning, where people were sort of systematically sleep deprived, or sleep restricted, I should say, or acutely sleep deprived. And they use measures of mostly cognition, right? So the psychomotor vigilance test is what they would look at. And depends on how much sleep loss you have, but somewhere between, for an acute period of sleep loss, it can take 1 to 4 days of recovery sleep to recover. But that means you're doing recovery sleep. It means that you're getting more sleep at night, or you're napping in the day, or you're doing a combination of both of those things to compensate. And so if you do that, you can catch up on your sleep. But, the scientist in me looks at the question more broadly too, right? And is someone who's doing constant sleep debt and repayment to a net of zero just as healthy as someone who is maintaining zero all the time? Like they're not constantly doing this, they're just staying flat. That question I don't think has been studied very well, but based on what my understanding of chronobiology is, that I still think that there are probably that person, even if though they're repaying and constantly at a net of zero, probably going to be, I think, worse off or have more negative health consequences than someone who's.
I would think because of the stress state, man. Like just like that, I don't know. You're going to be
you're right.
Metabolic. You're going to be pro-inflammatory for periods of time. Like
exactly.
Once again, nothing to back that up except for physiology. But
that's the physiology. Yeah. You're right.
No, absolutely. So this might be a nice transition into sleep hygiene or tips, because a lot of healthcare providers, because of the back and forth with night shifts, I hear tons come to me about how can I improve my sleep? I get that question almost every second day, to be honest with you. And I imagine you get this relentlessly. So in terms of when it comes to hygiene, like at least the basics, what are the things that come to mind?
Yeah, so if we just talk about sleep hygiene in general, right, outside of the context of shift work. Yeah. I mentioned some things, but first of all, routine, right? Routine. And that doesn't just mean, well, first of all, if you look at bedtime, wake time is probably the most important thing to keep consistent because it sets the tone for your whole day. Yeah. Okay. So that's number one, right? So consistent bedtime, wake time. If you had to sacrifice the nighttime and maintain a stable wake time. Eating at the same time of day is also very important to maintaining good sleep rhythm and sleep hygiene, sleep cycling. And specifically not eating, certainly nothing large within 2 to 4 hours of bedtime. Digestion is a pretty active process and it really causes a lot of sleep fragmentation. If you do it too close to bed, there's that idea, right, where you just like have a giant turkey meal, right? It's the classic one. You're like, I'm going to sleep like a baby, right? And maybe you do fall asleep faster, but the quality of your sleep is certainly worse. Mm-hmm. So that's something. Basically any real PO ingestion is not advised at least 2 hours before bedtime, and that would include water. You want to just have your system kind of empty. Not using electronics of any kind, blue light within an hour of bed. And it's not just the light. I mean, the light is a hugely important part, but it's the content, right?
That's a good point, actually.
Yeah, we constantly underestimate this, right? Especially in this pandemic world. People are watching the news at like 9 or 10, and they're going to bed. And I'm like, what are you doing? Like, can you just watch it at 6 or something? I'm hearing about the Middle East imploding. I'm hearing about,
In
pandemic
India.
issues, right? India, the developed world getting all these vaccines and the undeveloped world not getting any. Like these things, I don't want to think about these things right before I go to bed, you know? And even if you think that you're not affected by them, most of the time we are, right? It increases our sympathetic tone. And again, we talked a little bit about HRV, right? I mean, when you have a flat HRV, it's mostly because your sympathetic system is kind of overdriven, right? And that leads to more sleep disruption. Sleep is overwhelmingly a parasympathetic state. And so to go into it with a higher adrenergic tone than you should have is already setting yourself up for failure, right? So that's why that content is important. It matters. So again, no electronics of any kind within an hour and hour of bed. And it's really about setting up a good routine, right? So within that 45 to 60 minutes before bedtime, you got to have a routine, right? Brushing your teeth, washing your face, going into bed, and reading something on paper, like they used to do in the good old days, right?
I love it.
Right. And also being smart about that too. I mean, you don't necessarily want to read something that's going to get your heart pounding either, right? I mean, right. I read this book a while ago by this guy I love, David Goggins. And, I don't know. Do you know David Goggins?
The name sounds familiar, but it's not.
Yeah, he's like the hardest MF on the planet. Love this guy. And, my wife
Goggins. Yeah. He's the
ultra marathoner, Navy SEAL.
half brother. Yeah.
So
his YouTube is crazy.
Yeah. So my wife is reading his book right now before bed, and she's like, "This just gets my heart racing." I'm like, "Yeah, maybe don't read it right before bed, or she reads something afterwards, and that helps her, right?"
Yeah.
But it's very illustrative of what I'm talking about. So read something that's kind of interesting and fun, but that doesn't get your heart rate going. Exercise. So exercise is a powerful tool for sleep quality, and obviously many other dimensions of health. But again, not within 2 to 4 hours of bedtime, right? So exercise, especially if you're really giving it, as I hope you should when you exercise, you increase your sympathetic tone, and that's just not good for sleep. Other caffeine. So caffeine can have significant half-life. In the books, it's about 5 to 8 hours, but in terms of sleep, its impact can last 12 hours or more, right? And so my advice generally is if you have problems with sleep, no caffeine afternoon, right? There are some people, who do have it with supper and they're fine. They feel fine, whatever. Okay, fine. But if you have a problem with your sleep, be strict about caffeine, nothing after lunch. And if you're still having problems, maybe nothing after the morning. Alcohol, nothing within 4 hours of bedtime. Alcohol is great for putting you to sleep, but as it metabolizes, it raises your body temperature, which actively counters an important process for sleep. And so usually the second half of your sleep with alcohol at the beginning is very poor. And so it's a net negative. So you want to have that kind of mostly metabolized by the time you go to bed, so 4 hours. And in terms of exercise, going back, exercising in the morning is the best for sleep quality.
No, I think you hit all the major points there. I really like the point though of, just to reiterate, the lack of screens at night, because I think that's probably one that I feel like 90% of the population is a victim of. And you make such a good point about the content too, because it's like, how often are you reading something that doesn't draw emotion? Like it's designed for it. Your Facebook, your Twitter, it's all designed to draw emotion.
Oh my God.
It's
designed to be addictive, right? I mean, it's designed to keep dopamine levels in your brain. The CIO of Facebook resigned a few years ago because he knew what he knew and wasn't okay with it, having a young daughter, knowing how addictive it is. I stopped using Facebook 3 years ago when I watched him talk, And by the way, one of the best things I ever did for my overall mental health was to stop using Facebook.
Oh, I
sorry,
bet.
Sorry, Zuck and everyone else.
I bet. I know we're live streaming straight to Facebook right now, but it's like we're using.
Man.
No, it's all good. It's true, but it's true. Like it is. This is a way of like it's a very important point. In terms of, we're all trying to. This is a wellness platform, and we're talking about ways to try and improve your well-being. And I can't tell you how many people have told me, especially during the pandemic, when they quit their social media, how much better their quality of life is. When they quit the news, no one, I hate to, not to be like to go on a soapbox. You don't really need to be watching the news. I'm sorry. Like if it's important enough, you're going to hear about it. Then you can dive into it. But how often do you watch the 6 o'clock, 11 o'clock news and be like, man, I feel better about the world now. Myself, like my outlook on life is better now after doing that.
You're right. I mean, they're not really news delivery services anymore, right? They have their own purpose. They were there before Facebook with the whole capitalizing on the dopamine surges, right? Anchorman 2, I don't know if you ever saw that, right?
I don't think I saw the first one only.
Yeah, which is the classic, obviously. But the second one, they kind of talked about, how the sensationalization of media, right? Before the days of Walter Cronkite, where they really gave you news and you could trust it. Now it's just all about like getting you to watch the news, right? And so it's the same thing, right? It's really designed to get your dopamine up. So they did that before Facebook did.
Yeah, no, and I'll tell you from personal experience, Ruwan, like I've been censored, filtered. Some news networks will, if I'm being not sensational enough or not pessimistic enough, they'll cut my piece, after doing an interview. And to me, it really was eye-opening. Couple big points I think we should hit on before, it looks like there's only a couple questions here, but what's your opinion for like, how to approach shift workers? Like if you're doing the day and night alternating between that, is there anything that comes to mind in terms of whether it's improving overall sleep or quality of sleep for our listeners?
Yeah, it's a challenging issue. First of all, those sleep hygiene principles are always valid, right? They're sometimes more complicated to incorporate when you have a variable shift, but they're still true for the most part. So keeping in mind all of those things, right? Don't exercise right before you need to get to sleep. From a sleep medicine standpoint, I always tend to think of the individual, right? Because there's basically 3 phenotypes for people in shift work. There are the resilient individuals whose, I think, their genetics, place them in a favorable position. They can actually tolerate sleep work and shift work, and they adapt fine, right? So they probably don't even need any of this advice. Then there are the people who are vulnerable, right? So when you look at their responses and they just can never tolerate shift work. And then there are the people in between. And so really, it's really those 2 groups that I'm talking to, I think that we're talking to. And if it is truly impacting your quality of life, the primary recommendation truly is to stop doing shift work. Okay. I realize that may not be feasible for a lot of us. It might be though, for some, right? It might mean switching to a different department. If you're a nurse where you don't have to do night shifts, or if you can't get to day shifts, right? Then the next workplace modification would be to try to do only evening shifts. People who do evening shifts are much less likely to develop basically shift work sleep disorder, as we'd call it. It's not supposed to really happen with them unless, because of their domestic or family or social obligations, they can't sleep in the following morning. Right. Then they can, it's not shift work disorder, but then they have sleep restriction and all those consequences. And then if you can't do any of that, then ideally, you want to have, again, workplace modification, forward rotating shifts. And so what that means is, you go from days to evenings to nights, only in that direction and never backwards. Because our intrinsic circadian rhythm is actually a little bit longer than 24 hours, our body, we're just more able to tolerate forward shifting, sleep phase delay. So, if you have any control over that, if you're someone who schedules shift workers, and this is something you really need to know, Other things that bore out in the data are that your shifts shouldn't be more than 12 hours. You should have at least 12 hours in between shifts. If you're going to do rotating shifts, ideally there should be some stability there, where it's kind of like 3 weeks, 2 or 3 weeks of the same shift type before moving to the next. And these are all foundational. I mean, I realize it may not be exactly the answer to the question, but they're foundational. They're really important, right? And so, okay, so you assume you do all that. You do the best you can in terms to organize your schedule for your health. Well, how do you deal with shift work? Well, especially we'll deal with night shift predominantly because that's the one that's the biggest problem, right? And so when you're on night shift, we'll deal with, I guess, we'll start with the beginning of night shift, okay? Getting a nap in before your shift can be really helpful. Having caffeine at the beginning of your shift can actually be quite helpful. Somewhere, it depends on your individual sensitivities, but somewhere between 200 and 300 milligrams of caffeine has been shown empirically to be quite helpful. Exposing yourself to bright light in the first half hour of your shift, if feasible, can be very helpful. There are glasses that you can buy, there's no glasses inside them, but they kind of put light indirectly, bright light. You need, the studies show 5,000 lux, which is quite bright. Even 10 minutes, an hour for the first 4 hours can really help. As you approach daylight, if possible, having the opposite, so having a darker or avoiding bright light. If you go outside, you must wear dark sunglasses. When you're going home, you obviously have to go outside, definitely have to wear dark sunglasses. And I would say you keep them on until you go to bed. And in that note, really, you should just go to bed after you finish your work.
Brilliant.
Right? I know it's not easy, and some people go, I can't do that. Maybe you can't. But if you could reorganize things such that you could, that would be hugely helpful for your health. What I'm talking about here, really from, again, a sleep medicine standpoint, is achieving kind of a compromised circadian shift. And because of that, most people following this rule won't still be able to get a full 6 to 8 hours, right? Just because by basically afternoon or so, really, your just innate circadian rhythm, in consequence to what you just did and the night before, really wants to get you up. And so then comes the concept of anchor sleep, right? And so this is a period, usually 8 to 12 usually, where you're just always sleeping. You just prove that. And then you get up at 12. You can then do some of your your social obligations, your domestic duties, have a life. That's important too, really important. And then you get in another 3 to 4 hours later, somewhere in the evening. And so it's kind of a biphasic sleep schedule. And so that can help just by listening to your innate rhythm, and also allowing for the duties that most of us have, right? I mean, you could argue that if you do night shift work, that you should just stay on that schedule. And maybe in theory that might make sense, but it's not compatible with life, right?
Yeah, absolutely. Man, there's some gold in there, boy. Like I could already hear my people saying like, thank you. It kind of ties a little bit into what you said too about napping. Like you have a general premise, like, because naps, you'll hear a lot of different opinions on whether that's useful, not useful, duration of nap, whether there's such thing as a power nap. And as a follow-up to on night shifts, if you feel like naps or I guess sleeps or I guess whatever you want to call it, putting your head down is of value.
Yeah, absolutely. So yes, napping used correctly is completely acceptable, valid, powerful, and ideal. So with night shifts, if you're going to nap, again, it should kind of be in the first half of your night shift, because you don't want it to kind of rob that drive to get back to sleep at the end of your shift. So, brief naps, 20 minutes, 1 or 2 during your shift if feasible, helpful. They did a study with truckers a number of years ago, and they did, overnight drivers, and the regime was basically 2 20-minute naps and 10 minutes of bright light exposure, kind of, evenly spaced. The light was at the very beginning and the naps were a bit later. And they had objective improvements in psychomotor vigilance and reaction time. So it can be helpful. Now, Throughout the day, napping is completely fine, but within some rules, okay, within some guidelines. And so ideally, your nap should be less than 30 minutes. They can be restorative. They can help with mental function. The reason some people kind of don't believe me when I say that is because they often end up waking kind of later than that. Mm-hmm. And what happens is they're often waking up out of deep sleep. Mm-hmm. And then you have sleep inertia, which is brutal, right? And then makes you feel like I should have slept longer. So, I mean, the answer really is ideally less than 30. I suppose if you're going to sleep longer, it should be a full sleep cycle. But really less than 30, because, if you get a full sleep cycle in the day, that again is likely going to rob a bit more from your desire to get to sleep at night. Along that line too, is you really shouldn't nap like on a normal schedule. You really shouldn't nap after 4 p.m. because again, that's going to reduce that drive to sleep, right? We talked about homeostasis before. There's two processes with sleep. There's the circadian drive to sleep and there's a homeostatic drive to sleep. And that homeostatic drive is based on how long you've been awake and how metabolically taxed your cells are, right? Mm-hmm. And so it's normal. You're supposed to get tired and less sharp as the night goes on, and then it puts you to sleep. But if you do get sleep within kind of 4 to 6 hours of bedtime, it can impair your sleep at night.
It can mess you up. Yeah, no, I think of a lot of people too as using it as a tool if they're deprived, like almost creating that homeostasis because of you had a rough night before or what have you.
Yeah, and that goes back to the recovery sleep, right? So if you were acutely deprived of sleep, you can have a nap in the following day in the middle of the day. We have a natural circadian dip kind of between 1 and 2. That's why siestas occur at that time in smart societies and old societies. Yeah. So you can take advantage of that, but again, 30 minutes, and again at night, go to bed earlier. Right. So if you nap later, you can't get to bed earlier. Right. Mm-hmm. And if you go to bed earlier, then you can, again, maintain that stable wake time, which, as I said, is kind of the most important thing. Because when you're a bit more haphazard about this is what really leads to issues with insomnia. Because, if you don't wake up at the same time every day, right, if you go to bed late and just choose to sleep in, well, then that day you're going to want to sleep in later. Right. Mm-hmm. And then that's fine. But then the next day, if you can't sleep in, then you've truncated your sleep. And then it can become very problematic. And that's why with shift workers, biphasic sleep is one of the only solutions.
Absolutely. Thank you for that. Last question, I think, and is regarding the sleep aids or medication. Actually, we could do some. Yeah, medication. We've covered this a lot with Kirk, but basically saying that like nothing's really that helpful in terms of restorative, for restorative sleep. So maybe the emphasis, Ruwan, could be on if there's anything that is helpful, what do you think it is?
In terms of medications, you mean?
Yeah.
Yeah.
You could go even too if you want to do the night cover thing or earplugs.
Oh, yeah, for sure. Yeah. Yeah, well, that's an excellent point. So having a very dark room, and I actually forgot to mention that for the shift workers, I'm sorry. When you get home, you've been wearing your glasses, your sleep environment must be as dark as possible. And even if it is dark as possible, wearing an eye mask and putting in earplugs, hugely helpful. Especially for shift workers, but for all of us, okay, wearing a comfortable eye mask and putting in earplugs can improve sleep quality and increase the quality of the sleep that you get. As I mentioned, exercise is a powerful tool, not within 2 to 4 hours of bedtime, for improving sleep quality and getting a more restorative quality of sleep, and following good sleep hygiene, as I said. But then that's kind of mostly it. Making sure your environment, by the way, is also comfortable. It's better to have a cooler sleep environment than a warmer one. So you can thermomodulate using a blanket. Because the room is cool, right? Rather than having the room be too hot and always being under the blankets, that's not good. Your body temperature needs to drop to have good quality sleep. In terms of medications, sleep docs are the least likely to prescribe them because we always want to have more holistic and organic approach to sleep and treating any underlying organic sleep disorders. But, melatonin is usually reasonably safe medication. It is intrinsically what our brain uses to get to sleep. And of course, having said that, it's less useful when you already have endogenous melatonin. And so this is a bit perhaps technical, but like whenever you naturally want to get to bed, basically 2 hours before that is your DILMO, or your dim light melatonin onset. And that's when you start to produce melatonin. And so really melatonin is most effective at that time at lower doses. It can be more of a sleep aid in higher doses, so kind of above 5 milligrams. So you could use that as a hypnotic or soporific, and it can help with sleep. Trazodone is a reasonable sleep medication that doesn't impact your sleep quality too much, or doesn't impact your airway. It's pretty safe. Lyrica and gabapentin can be useful for insomnia. There are other medications like zolpidem or zopiclone. They're in many ways basically benzo derivatives. They can work. There's no long-term safety studies with them. I don't love them. They're the least to prescribe, especially on a regular basis. I don't like them.
Yeah.
Yeah.
And so I just thought of another question that I know people are going to ask. So we talked about getting back to sleep, or getting to sleep initially, but what about the people that it's 4 a.m. and they're having a tough time getting back to sleep? What do you like to recommend?
Yeah. So again, some understanding about the principles, right? That sleep drive I talked about, it's highest at the beginning of the night, right? And so the longer you sleep before you wake up, the less drive you have to get back to sleep, right? So it's more fragile the later it is. And so the number one advice I have for people is to avoid stimulus. And so that's where things like an eye mask and earplugs really actually have a lot of power. Because if you're less likely to see ambient light or less likely to hear things in your room, you are more likely to just be able to kind of get back into sleep. If you look at the time, okay, this is more problematic than most people really realize. And it's because there is an alerting aspect to just looking at the time and understanding what time it is.
Yeah.
Right. So, almost whatever time you look and see what time it is, it's usually not going to be a happy answer, right? Like, most of the time you're going to think, it's 3 a.m. Damn, I got to be up in 3 hours. Then you look again because your sleep is now disrupted. Now it's 3:30. Now it's 4. It creates and increases sympathetic tone, which is, again, as I've explained already, not good for sleep. So number one thing is never look at the time. If you have to get up at a specific time, set an alarm and trust that if you haven't heard it, it's not time to get up. Just try to go back to sleep. There are also Phillips awake lights, which I really like, where because if you want to kind of time it with a cycle, you might not be able to predict that. You set your alarm at 6 and maybe it's 10 minutes too early, right? Mm-hmm. There's a Phillips awake light, which can help with that, which kind of sets a window of about 30 minutes with gradually increasing light. And so, if you do want to peek up at least just to see in your room, is the light on, you're not even close to the window. That's a nice one. Just click, and then just trust and just relax and go back to sleep. Now, if this doesn't work, look at the time, you do everything you can, and you are awake, what you should do is give it a small chance to see if you can get back to sleep. And without looking at the time, right, if you can intrinsically estimate something like 15 to 20 minutes, give it that kind of time. But if you're awake, you got to get up and you actually have to go to a different room. That room should be dimly lit. Again, there should be no real outside influence. You shouldn't be able to see the time. You should not look at electronics. You can read something, but it's got to be really boring, right? It can be like an instruction manual or the dictionary or a Bechamel, unless that stuff excites you, right? And when you feel tired, you then just put it down and go back to sleep. If you don't feel tired and then the sun comes up, well, guess what? You start your day. You can have a nap if you want, following the rules that I explained, but then that night you're going to have more delta power. You're going to have a higher drive to sleep, and you're likely to have more sleep maintenance. And so when it happens, if you cut it at this phase, at this step, right, you can maintain normal sleep. But when people don't follow these rules, then you can get a lot of chaos in your sleep schedule. And then you mix in shift work, and then you mix in not being strict with your wake time. And then you can see how you can easily destabilize your sleep pattern, right? A lot of the problem here, I should just be clear, it's a psychophysiologic phenomenon, right? So what's really happening when you stay in bed and struggle, which is what a lot of people do, is that you create a negative subconscious relationship with your bed and your room.
Yeah.
Right? Your brain is supposed to look at your bedroom primarily and your bed specifically and say, I love this place. This is where I sleep. This is the bomb, right? But if you spend a lot of time in there struggling, awake, watching TV, right? Your brain either says, oh, this isn't the place where I just sleep, or your brain says, man, I struggle here. Or you start to wonder before you go to bed, gee, I wonder what tonight's going to be like. What time am I going to wake up? This is all really bad. It's a bad harbinger of the night to come, right?
Conscious and subconscious.
Yeah, it's hugely powerful. Yeah.
Yeah, no, boy. Tell me Ruwan wasn't throwing down some gold. Podcast Nation, solving wellness community. I just want to thank you, Ruwan, for the knowledge that you threw down, because this is, I know it's going to be super informative, super helpful for a lot of our listeners, because once again, this is a common question that we get on a regular basis: how to improve sleep quality, sleep duration. And as you so eloquently said, this is something that ties into health in general, preventative medicine.
It's foundational.
Yeah, right? It's foundation. That's a great way to put it. It's foundational. Yeah. So yeah, we just want to thank you for your efforts and your time, and keep doing what you do, my friend.
Thanks, man. It's my pleasure. I hope it was helpful.
For sure. Podcast Nation, I hope you thoroughly enjoyed that episode with Ruwan. He's a gem, and it was great to hear some of these tips to improve our sleep. Once again, jump on the Solving Wellness train, my friend, solvingwellness.com. You're a healthcare provider. We want to help change that boogie. You'll be able to provide better care for our patients if we're taking care of ourselves for real, yo. All right, follow us on Twitter, Instagram, or YouTube at Quadcast. Leave any comments at quadcast99@gmail.com. Yo, subscribe to the show if you haven't already. Leave that 5-star rating. We love it. Helps with the visibility of the show. Y'all stay safe. Be good. And we'll connect again real soon. Peace.